Imagine waking up with a dull ache in your left shoulder. You might blame it on sleeping wrong, overdoing it at the gym, or too much time at your desk. The shoulder is a complex joint prone to strain and injury, so it's easy to dismiss pain as something minor. Most of the time that's true. Shoulder pain is usually musculoskeletal, caused by daily wear and tear or arthritis. But sometimes this habit of brushing off pain can be dangerous. Our bodies have warning systems, and pain in one area can signal trouble elsewhere, especially when it comes to the heart. The nerves serving the heart are close to those for the shoulder, arm, and jaw. When the heart is in distress, like during a heart attack, pain signals can get mixed up, making you feel pain in your shoulder instead of your chest. That's why it's critical not to ignore sudden, unexplained left shoulder pain. If it comes out of nowhere, pause and consider if something more serious could be happening. Ignoring this signal, especially if other symptoms are present, could mean missing a life-saving warning. Sometimes your body's subtle messages are the most important. Don't just treat shoulder pain as a minor nuisance. Understanding this connection could protect your health and your life. Listen to what your body is telling you. As a neurosurgeon and medical correspondent, I've seen too many patients ignore subtle warning signs. Pain is your body's way of saying something's wrong. In our busy lives, it's easy to push aches aside, thinking we're being tough. But when it comes to your heart, ignoring pain isn't strength, it's risky. Early intervention is key, especially for heart attacks. A heart attack happens when blood flow to the heart is blocked. The longer you wait, the more damage occurs. Time is muscle. The sooner you get help, the better your outcome. Recognizing early warning signs is urgent. Don't be a passive observer of your health. Pay attention to new or unusual symptoms, even if they seem minor. That nagging shoulder ache, unusual fatigue, or shortness of breath could be your heart's cry for help. I'd rather see you in the ER for a false alarm than hear about a preventable tragedy. Listen to your body's language. Take action when something feels off. Your heart depends on your attention. Don't wait until it's too late. Why does a heart problem sometimes show up as shoulder pain? It's called referred pain. The nerves from your heart and left shoulder travel similar pathways to your brain. When the heart is in trouble, pain signals can get misrouted, making your brain think the pain is coming from your shoulder. That's why heart attacks don't always feel like crushing chest pain. They can show up as a deep ache in your shoulder, jaw, neck, or back. If you only expect chest pain, you might miss a heart attack's real warning. Knowing this empowers you to connect the dots between symptoms. Don't ignore unexplained shoulder pain. Recognize it as a possible sign of a heart emergency. This knowledge could save your life. How do you tell muscle pain from a heart warning? Muscle pain usually follows an injury or overuse, feels sharp with movement, and is tender to the touch. Heart-related pain is deeper, more diffuse, and may feel like pressure or squeezing. If pain worsens with exertion and eases with rest, that's a red flag, especially if it's new or unexplained. Watch for other symptoms: shortness of breath, cold sweat, dizziness, nausea, or pain radiating to your arm, neck, or jaw. Heart pain often spreads while muscle pain stays put. If you notice this pattern, don't ignore it. These are not signs of a pulled muscle. They're your body's emergency broadcast. Take them seriously. Act quickly if you notice these warning signs. Not all heart attacks are dramatic. Some are silent or have subtle symptoms. Silent heart attacks may feel like mild discomfort, fatigue, or indigestion, and are often mistaken for less serious issues. The danger is in their subtlety. People don't seek help, and heart muscle is damaged. Sometimes silent heart attacks are only discovered later during routine tests. People may recall feeling unusually tired or having unexplained aches, but dismiss them at the time. Public awareness of these quiet symptoms is crucial. Move beyond the stereotype of crushing chest pain. Learn the quieter signs: days of fatigue, mild shortness of breath, discomfort in the back, jaw, or left shoulder. Recognize these clues as possible heart warnings. Early recognition prevents long-term damage. Don't ignore the subtle signs. Silent heart attacks can happen to anyone, but some people are at higher risk. Women often have atypical symptoms: fatigue, shortness of breath, or pain in the back, neck, jaw, or shoulder. The elderly may not feel classic pain and can mistake symptoms for other conditions. People with diabetes may not feel chest pain at all due to nerve damage. Their symptoms might be weakness, sweating, or breathlessness. Those with high blood pressure or cholesterol are also at greater risk. If you fall into these groups, be extra vigilant. Manage your health conditions and watch for subtle signs. Caregivers should take new complaints seriously. Knowing your risk can help you act quickly. Knowing the signs is only half the battle. You must know when to act. If you have unexplained left shoulder pain, especially with other warning symptoms, seek emergency help immediately. Don't drive yourself. Call emergency services. Paramedics can start treatment right away, saving precious heart muscle. Every minute counts. Call for help if your pain is sudden, severe, or unrelated to injury. If you feel pressure in your chest, shortness of breath, cold sweat, nausea, dizziness, or pain radiating to your arm, neck, or jaw, don't wait. Don't waste time searching online or asking friends. Don't worry about being wrong or embarrassed. Medical professionals prefer a false alarm to a tragedy. Trust your instincts. If something feels seriously wrong, act fast. Your life is worth it. Prevention is the best defense against heart disease. Schedule regular checkups to monitor blood pressure, cholesterol, and blood sugar. If you smoke, quit. Nothing protects your heart more. Exercise regularly. Aim for 150 minutes of moderate activity each week. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, sugary drinks, and unhealthy fats. Get enough quality sleep. Poor sleep raises heart risk. Know your family history, genetics matter. Share this information with your doctor. By making these choices, you're building a healthier future. Take charge of your heart health today. Ultimately, the message is simple. Listen to your body. Don't ignore signals like unexplained pain or fatigue. True strength is in paying attention, not pushing through. Your body is your partner. When it sends a warning, it's trying to protect you. Don't let fear of a false alarm stop you from seeking help. Share what you've learned with loved ones, especially those at higher risk. Raise awareness about atypical heart attack symptoms. Create a community where everyone listens and acts quickly. If you or someone you know feels a strange ache in the left shoulder, pause and consider the context. Look for other signs. If in doubt, make the call. Don't dismiss or delay. Listening could be the most important decision you ever make. Protect your heart, and it will protect you. Your future depends on it.